right, good evening. I would like to welcome you to tonight's virtual program, Maximizing ROI with the Gentle Pro Series live webinar with Dr. Patel Schallen and Hamish McNair. If you encounter any issues with the video or connection, please refresh your browser as I will often fix minor issues. Google Chrome is the preferred browser. This didactic content is intended for global training and educational purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local laws, or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. Please discuss these as well as risks and benefits of this procedure with your qualified healthcare professional to determine whether this procedure is appropriate for you. So with that, I'm very pleased to introduce our moderators for this event, Dr. Patel Schallen. She's a Senior Vice President of Clinical Operations and Medical Director at Candela with her own clinic aesthetic practice based in Jacksonville, Florida. All yours, Dr. Schallen.
Thanks a lot, Joanne. Welcome, everybody. Thanks for joining us today. Hamish and I are happy to bring you some additional information we hope that can be useful to you for those of you who are Gentle Series users, either thinking about Gentle Series or users already. I'd like to just start with just by backing up and looking a little bit at the global medical aesthetic market, just to put all of this in a framework. The market size for this aesthetic market globally is very large, and it is continuing to grow to nearly 25 billion by 2028. That's just a very, very incredible market that's expanding. It's exciting. More and more consumers, patients, are interested in aesthetic treatments and treatments that are medical aesthetic based. So it's exciting to be able to have a device that can cater to this market size with the versatility that the Gentle does offer. The other interesting things on this slide just kind of highlight the importance of the market to show that the compounded growth rate is also over double digits. The number of procedures is incredibly large, 86 million procedures in 2019. They'll be projected much, much more over the next 10 years. And the interesting things too are just the variety of patients entering the market, in addition to the variety of skin types, also a strong patient demand from younger patients and from men. So there's some very interesting things, especially with Gentle Max, that can be utilized to capitalize on this growing market trend. The market forecast by 2028, which is just a few 4 short years away by product segment, shows that energy-based devices are continuing to grow, more than double. And so we fit very, very nicely into this particular product category. We've got incredible versatility with Gentle, and that's one of the things that we want to make sure that everybody who owns a Gentle or is thinking about a Gentle or entering this space really understands. The Gentle is a phenomenal laser for hair removal. It is really best in class. It has the largest worldwide install base and over 25 years of legacy. There's a reason why it's the #1 preferred laser across the world in all hair removal chains. It's because it works hard and it works well. It provides safety and efficacy across all skin types. And you can see here the importance of pulse duration along with the amount of power when you look at difficult to treat hair, fine hair, and also additional versatility when you talk about not just hair, but treating pigmentation. So Hamish is going to talk to you a little bit more shortly about additional varieties, but I'd like to just briefly touch upon some of the things that you can do with Gentle. So we talked about hair, pigmentation. You can talk about the skin treatments and generalized rejuvenation treatments that can be performed with the Nd:YAG and 755 in combination. You can see the improvement on the left-hand side of the jawline on this patient, and some of the reduction even in some of her submentum. And this was carried out with the combination, but mainly with the 1064 nanometer handpiece, along with the painting technique. The 1064 is also highly, highly versatile in treating onychomycosis. And I know my patients that are sent over to me from my dermatology colleagues are very, very grateful for this treatment because it really helps them with their toenail fungus. And this bottom patient is a combination of 755 and 1064 nanometers, where we see that the chorioangiomas on her abdomen have been treated, the pigmentation on her abdomen have been treated, and also just the overall skin texture is improved on this patient with a combination of treatments. So lots and lots of things that you can do with Gentle, hopefully to optimize what you're able to offer in your practices, and also be able to quickly establish a return on the investment. I want to introduce to you somebody many of you already know. This is Hamish McNair. Hamish and I have worked together for many years. Hamish is a registered nurse and is qualified as a registered nurse since 1985. He's worked at the National Health Service in the UK for 4 years before joining the Royal Air Force as a nursing officer for 8 years. And when he left the RAF, he worked for Johnson & Johnson as a sales manager. So he understands clinical sales as well. We were happy to have him join the aesthetic field 18 years ago when he joined with one of the other large companies and has a vast background and knowledge. And we've been lucky to have him at Candela for over 12 years as our Director of Clinical Education in EMEA. So Hamish, glad to be sharing this time with you. And I'm going to turn this over now to you, and I'll answer questions in the background.
Okay, thanks, Kanika. So welcome, everybody. Over the next 30 minutes or so, what really I want to do is talk about the GentleMax Pro system and just give you an insight into all of the different treatments that the machine is able to offer. And therefore, by being in a position where you can offer a bigger range of treatments for your patients, it's going to increase the revenue and therefore the return on investment. So when we're looking at an ideal laser, is there such a thing as an ideal laser? You want a laser that's able to treat multiple indications. You need also to be in a position where you can treat a wide range of different Fitzpatrick skin types. The ability to change the size of the spot, because if you're treating large areas, you need a large spot. If you're treating something much finer, you need a smaller spot. So that option to be able to have a range of different spot sizes. Again, pulse duration is so important, not just when we're dealing with hair removal, but also when we're looking at treating vascular lesions. So being able to have a range of pulse durations, but also critically, not just a range of pulse durations, but having a range of fluencies that actually sit with those pulse durations to give clinical efficacy. So, and finally, you need a machine that's not complicated from an operator point of view, so something that's easy to use. So the Gentle Pro series, it's a dual wavelength. So by having two wavelengths, the 755 Alexandrite and the 1064 Nd:YAG, it means we can treat a wide range of skin types. We can treat, depending on the condition, anywhere from a Fitzpatrick skin type 1 right through to a Fitzpatrick skin type 6. Variable pulse durations, again, depending on what it is we're treating, we can be anything down. We can actually even use the system in a micropulse configuration when we're doing things like diffuse redness and treating lines and wrinkles. And we can go up to much higher, 40, 50, even 60 millisecond pulses. Big range of spot sizes, from the smallest, which is something we use for our vascular side of things at 1.5 millimeters, right up to a 24 millimeter when we're treating much larger areas for hair reduction. Big range of fluencies. We have two different options of cooling, we have DCD cooling, and we also have the option of using air cooling. There's a touch screen, which makes it very easy to use. And it also, the handpiece is very simple to actually handle, and it makes it really comfortable when you're doing your treatments. So looking at the indications we have, obviously the biggest thing everybody tends to buy this system for is hair reduction. And by utilizing two different lasers, two different wavelengths within the system, it means we can treat the full range of skin types, Fitzpatrick types from 1 through to 6. Also with our alexandrite, we can treat pigmented lesions. And then moving on to the Nd:YAG, vascular lesions, we can treat lines, wrinkles, diffuse redness, and onychomycosis. So a big range of treatments that you can use across both of the wavelengths that the machine has. So let's look first of all at the cooling of the machine. Obviously, it's really important that we have some kind of cooling to protect the epidermis when we're doing our treatments. So we can use an air cooling option where you have a separate air cooling, air chiller system that you connect to the handpiece. As you can see the picture on the right-hand side of your screen there, where you're on the bottom, you have this section that you attach to the handpiece, and this then directs that cold air right to the point where you're delivering the laser energy. Or the other option is to use the dynamic cooling device, which is using cryogen. So we spray a very prescribed amount of cryogen onto the skin. We then wait for maybe 20, 30 milliseconds. And during that delay time, it then provides, you get the evaporation of that cryogen, which actually cools the skin before the laser itself fires. So this gives us, again, a very, very precise, very effective way of cooling the skin when we're delivering the energy to whatever the target is that we're trying to destroy, but not then damaging the surrounding tissue. The biggest use of the machine is laser hair reduction. And if we look at the CE mark definition, it's stable, long-term, or permanent hair reduction. Permanent hair reduction is defined as the long-term stable reduction in the number of hairs regrowing when measured at either 6, 9, or 12 months after the completion of a treatment regime. So basically, we're looking at a 6, 9, and 12-month point after your patient or your client has completed their course of treatments to show that we're not getting this regrowth of hair after the treatment. And how does it work? It's basically we're targeting the pigment in the hair follicle itself. And the energy heats up that melanin within the shaft. We get the heat to a high enough temperature that we start to get that heat diffusing into the wall of the hair shaft, and therefore having an effect on a couple of very critical areas within that system. So first of all, the bulb, which you can see sitting at the bottom of that hair follicle. So we heat that up, and particularly one of the important things here is that we're heating up the dermal papilla, and this is where we have the bloodstream and the nutrients entering the hair. So if we can heat that area to a high enough temperature and destroy not just the blood supply but the nutrient flow, then there's no blood flow into that hair follicle. And secondly, equally as important, is the bulge area, which sits around about where the erecti pilli muscle is, and this is where the stem cells are. So if we can not only destroy the blood supply into that hair, but also within that bulge area destroy the stem cells, then we're not going to see another hair growing in that follicle. Unfortunately, we can't do it as a single treatment because I'm sure, as many of you are aware, there is a growth cycle of the hair, and it's only in that anagen phase that we're actually having an effective destruction of all of those structures we're looking for. Because as you can see from the diagram here, that's the only time that we have full contact between the hair and the shaft. So therefore, we have that direct heat diffusion from the hair into those structures that we're trying to destroy. And as we move into the catagen, telogen, etc. stages, you can see the hair is becoming thinner. It's detached itself from the blood supply, and it's in the process of shedding. So we don't have that same direct contact with those structures that we're trying to destroy. And the other point to remember here is different parts of the body have different percentages of anagen hair. So for instance, the face, the underarm, bikini line have much higher percentages of anagen. So therefore we need to treat those areas more frequently. And then trunk and extremities, so arms, legs, etc., have less anagen hair. So we need longer periods of time between the treatments to allow sufficient hair, anagen hair to be there for us to then target it with the laser. And studies have shown that we get at least an 80% reduction after a series of treatments. However, we can't treat white hair, blonde hair, or gray hair because there physically is there's not enough melanin, not enough pigment in that hair for us to actually get any absorption of that energy and therefore heat into that structure. And also you will find red hair and sometimes it can be very variable treating red hair, whether or not we will get good results. Again, it depends how much pigment is actually within that hair. One of the big advantages and areas that we've developed with the machine is increasing the size of the spot. So in the original system, the maximum spot size that we had was 18 millimeters. So we now have up to a 24 millimeter. And the purpose of having the larger spot sizes means, obviously, 24 millimeters is a bigger surface area, so it covers a larger area more quickly. And therefore, it means that if we take, for instance, the treating a man's back, and we move, from treating with an 18 millimeter up to a 24 millimeter, you can see we're moving from just under 30 minutes to just over 20 minutes to treat a whole man's back. So we're saving 10 minutes in a treatment. And also we're using less pulses. So we're moving from 1,097 pulses with the 18 millimeter to just over 600 pulses using the 24 millimeter. So it's quicker. And it's also more comfortable because you're not actually delivering the same number of pulses to the area on your patient. So it becomes a more comfortable treatment and it's much quicker. And these two things then relate to the fact that you're actually then able to treat more people per day, which is increasing your revenue and therefore increasing your return on investment, as you can see from the bottom part of the slide. And just looking at a number of before and after pictures. So this is 3 months post 4 treatments. And similarly here, we have very nice results. And even when we're treating darker Fitzpatrick 5 or even Fitzpatrick 6 here, we're getting very nice results very safely. We're not seeing any damage to the tissue. We're not getting big areas of post-inflammatory hyperpigmentation or even hypopigmentation. So very nice even skin color post-treatment and much improved condition here now for this individual. He's not getting these ingrowing hairs which are causing this inflammation and infection and pain, etc. So
that nice one's, results. If you just want to back up a little bit, I just wanted to stop and I just can't, you're right. I can't emphasize enough how important the YAG is for these types of patients. And even a lot of women in the bikini area have ingrown hair and it's hair removal is such a fantastic option. And of course we see patients all year round in Florida and we don't need to slow down because of the Nd:YAG. So I know that's very important in the southern sunnier climates and sunnier parts of Europe as well. So this is important. And also what you mentioned about the speed and efficacy is really important. With a 24 millimeter spot size, you can really take care of large areas very quickly. And this is, of course, with the GMP and with the GMPP, which is something a bit different, but even more exciting, because we have more power, more energy, more speed, and the ability to go even faster with higher powers. So it's really a great tool in the office.
Okay, thank you. So here we're treating the back of the neck. So another area where the machine, I think in a lot of clinics is probably underutilized, is the treatment of pigmented lesions. And it's important at this point to specify that we're talking about benign pigmented lesions. And these typically are flat. They normally have a very well-defined border. They can be round, oval, or sometimes slightly irregular in shape. And the size can vary quite dramatically. They can be a few millimeters in diameter up to several centimeters, depending on what the condition is, and I think sometimes where the pigmented lesion is on the body, and really how much sun exposure that area has had. So, a couple of things that we can treat freckles. These tend to be very small, 1, maybe 2 millimeters in size, but sometimes they do become a bit larger. Sometimes they will clump together a little bit more. Normally, these freckles present 2, maybe 3 years after birth, sometimes longer, but on average, it's that kind of term. And obviously, we see them in the majority of patients. We see them on the face, arms, chest, so areas that really get exposed to the sun. And they do tend to become much darker during the sunnier months, and they fade during the winter. Lentigines are bigger than the freckles. As you can see from the picture, they tend to be dark brown, more common over the age of 50. I think that is dependent on how much sun exposure somebody has. You can have a patient or a client in their early 30s with an awful lot of sun damage, but it's typically, you tend to see it in patients over 50. And these, interestingly, unlike the freckles, you tend to find that the lentigines stay the same color through the seasons. They don't become darker in the summer and lighter in the winter. And people call them age spots and even liver spots. So very, very common. This is probably the commonest kind of pigmented lesion you're going to see within a clinic. Less common, but again, a big issue for a lot of your clients will be cafe au laits. And as the name suggests, they're kind of a milky coffee color. They normally present on the trunk or upper arms. Smooth, sometimes irregular, but they tend, and again, size-wise, they can vary dramatically in size. They can be right down at kind of 0.2 centimeters, and sometimes in some instances they can be as much as 30 centimeters. So they will vary greatly in size. But all 3 of these indications can be treated with the alexandrite, with the 755 nanometer, not generally with the 1064. You need 2, maybe 3 treatment sessions in order to achieve these results. And what we're looking for when we treat is we're looking for this lesion to go darker in color. And then over the course of probably 7 to 10 days, it will have developed a little microcrust, and then that microcrust will slough away, and underneath the skin will be a lighter color, and after the second treatment, lighter again, etc., etc. So that's the nature of what we're looking at. And similarly, in this patient, this is 6 months after 4 sessions. So you can see we've got a much more even skin tone, much less of that sun damage, much less of that pigmentation. And this will have been done using what we call our painting techniques. We will have used a larger spot size, probably an 18 millimeter, and we'd have gone over the area with a single pass, but managing to treat all of these little lentigines in one much quicker treatment session with, as you can see, really nice results. And similarly here, I think this would probably have been the painting technique because it's such a large area that's being treated. An area that I find always really interesting when I'm doing my training sessions is vascular lesions. They can be some of the most rewarding because you literally see a result right in front of your eyes as you're in that treatment session. And we tend to use, most of the time, we tend to use the Nd:YAG, the 1064 nanometer. There are occasions where we can use the Alexandrite, the 755, but in general, it tends to be much more advanced treatments and advanced users that will be using the 755 for things like resistant port wine stains, as an example. So here we're targeting oxyhemoglobin and deoxyhemoglobin. So we're looking at both the redder vessels and the kind of purple and bluey colored vessels. And what happens, a couple of things, we have a combination of reactions going on here. First of all, the Nd:YAG in particular absorbs into either the oxy or the deoxyhemoglobin, heats up the blood and coagulates it. But in addition, you get a diffusion of that heat into the walls of that blood vessel. And because blood vessels contain collagen to allow them to expand and contract, you get some contraction of those collagen fibers by putting the heat in. So if the vessels are really small, you see the vessel literally collapse, and I'm going to show you a video in a moment that hopefully you can see that. Or alternatively, the vessel actually, the lumen becomes smaller, so therefore there's less blood flow, so it becomes easier for the coagulation to occur. So it's a combination of things that work really nicely together to give us more efficacy in the actual treatment of these vessels. So as I said before, advanced users with the Alexandrite, you can treat facial vessels, leg veins, hemangiomas, and resistant port wine stains. The reason that we tend to put this into the hands of advanced users, firstly, treating port wine stains and hemangiomas, you really need to have a lot of in-depth knowledge of vascularity to do this. And with facial vessels and leg veins, because an Alexandrite has such a strong absorption into melanin, you have to consider very carefully the Fitzpatrick skin type that you're treating with an Alexandrite, because we're using much higher fluencies when we're doing something vascular, and the concern there, if you don't have that advanced knowledge, you can cause issues with darker skin patients and clients. So I tend to concentrate most of my training with the vascular onto the 1064, where we're treating facial vessels and leg veins. It's very effective, highly efficient, and if it's used correctly, has a very good safety profile. So what are we treating? So we're treating broken vessels, facial vessels, so telangiectasia, leg veins, up to about 1.5, maximum 2 millimeter diameter, spider nevi, cherry angiomas, venous lakes, and also diffuse redness. So a big range of things that we can treat with the vascular handpiece. And I think equally as important, it's to think about what we can't treat with the system. We don't, as I said before, tend to treat port wine stains. If port wine stains are being treated, it tends to be if they're resistant to other forms of treatment. So using, as I said before, the Alexandrite, the 755, or if you have the larger kind of vascular nodules within the more mature port wine stains, you would then consider using the Nd:YAG. But this is really for experienced vascular surgeons. Same with hemangiomas. Very complicated leg vein systems we don't tend to treat. We definitely never treat varicose veins and any lesion that sits within the orbit of the eye. So this is a little video that you can see. And if you look at, this vessel, you see it disappear. And then it comes back slightly darker, you can see that just before they applied the ointment. So this is typically what you want to see. You either want to see that vessel disappear because you get that vasospasm that I was talking about earlier with the contraction of that collagen. And some of these tiny vessels you will get that contraction and they don't reappear. Other ones will reappear after a couple of maybe 30 seconds, a minute or so. And the bigger vessels, you don't see them necessarily disappear, but you get a blurring of the line of the vessel. It becomes less in focus and it becomes darker in color. And then if you press your thumb onto that vessel and then lift it up after a few seconds, you don't see any refill. So you know that you've actually got that coagulation. Some reason, there we are. And now here we have some before and afters. So I think this is something that most clinics will see clients with these and we get really, really nice results. I would tend to say tell your patient you need 2 sessions because we remove the majority of these vascular lesions in the first session. But we can't, with an Nd:YAG, we cannot go over the same vessel in the same session again. So if you've tried to coagulate one vessel and your settings are slightly out, you need to leave that vessel and then treat it in another treatment session. So quite often you will get 90% clearance and then you need to bring your patient back just to clear the last 10% to give them a really good, nice clearance. So more facial vessels here, also nasal vessels here. As I said, these are so rewarding to treat because you see an instant result as you're doing the treatment. And similarly, when we're treating any leg veins, really nice results here as well. So moving on from those, so I think if you look at the usage of the GentleMax Pro, the highest percentage of our customers are using it for hair removal. Then we have another group who are using it for pigmented lesions and obviously the vascular lesions that we were discussing just now. There's 3 other areas where the machine is, I think, really valuable as a tool within your clinic. One is the treatment of facial wrinkles. And as we all know, as we get older, we decrease the levels of collagen within our tissues. So we get lines, wrinkles, sagging, etc. So what we're aiming to do with this treatment is by gently heating up the dermal layer, we're stimulating this thermal injury. And the result of that thermal injury, the body's response to that thermal injury is actually to start producing new collagen. We're not going anywhere near the same temperatures that we are when we're destroying a hair follicle or pigmented lesions or coagulating a blood vessel, which means it's a much more comfortable treatment for your client. We're looking at getting the surface temperature to somewhere between 40 and 43 degrees centigrade, which is approximately the temperature that most people have their bath water. So it's a comfortable temperature, but it's not really hot. And we do this by multiple passes over the area. And you can see we defocus the handpiece. So we use an 8 or 10 or a 12 millimeter spot size, defocus the handpiece so we get more diffuse energy delivery rather than very, very focused delivery. We cover the area multiple times and we run the handpiece at between 5 and 7 pulses per second, so 5 to 7 hertz. And we cover an area as you can see, about the size of a business card. So we go over this area multiple times till we reach our temperature 40, 43 degrees. Then we move to another section. We do exactly the same there till we get to temperature. And then we move on to a third section and a fourth if necessary. And what I tend to do, if the patient will tolerate, I will then do another 2 or possibly 3 cycles. So you're doing so you're getting to temperature in one area, move to another, bring it to temperature, another one, bring it to temperature, and then you go back to the first section again, and bring it back up to that 43 degrees. But just remember, as you do the subsequent extra cycles on those areas, the temperature is higher anyway, so you will get to that temperature more quickly. But the key here is really getting to that 40, 43 degrees and maintaining it for enough time that you actually are stimulating good proportions of collagen. And this is the picture that Kanika showed you earlier. So this is 3 months after 4 sessions. And what we tend to recommend is about 4 sessions, and you do 1 a month. Remembering, of course, that collagen is going to take 3 months to really properly develop. So you're only seeing the real results when you get to treatment number 4 from treatment number 1. Although the added advantage is because we're putting that heat into the tissue, the first thing your patient's going to tell you is their skin looks better, it's more radiant, the pore size is smaller, and we probably increase the turnover of the tissue a little by that extra heat. So that's the first thing they see, but the lines, wrinkles, and tightening of any tissue only occurs after 2 to 3 months because of that collagen that we're waiting to form.
Yeah, if I can interrupt, and we just go back to that picture again. There's a couple of things that you can accomplish with the painting technique on gentle. And one of them, as you mentioned, is diffuse redness. So here we're not showing the full face, and this is not the patient's chief complaint, but if you did have a patient, particularly a darker skinned patient with some diffuse redness, the 1064 is, of course, very, very safe. So in addition to the improvement in skin tone and texture and pores, like Hamish just described, you also get this improvement in fine lines, of course. But additional to that, if you have redness, it does also improve this diffuse redness. So you have sort of a twofold improvement. Then here, what we did was a bit different underneath the jawline because we wanted to see some reduction in the segmentum. And there is where you do need to hold the temperature. And that, of course, is dependent upon the patient tolerance. But holding that temperature in using that painting technique or a combination of the stamping and painting technique really brings up the temperature in the adipose layer and creates that effect that you see here. So it's highly versatile, and to be able to do this, the patients really like the effect, both for the short term as well as for the longer term.
Thank you. I'm going to show you a diffuse redness patient now. So the technique when we're treating diffuse redness is almost identical to when we're looking at the lines and wrinkles treatments. So we're using microseconds, we're using an 8mm spot size, about 10 joules, 10, sometimes 12 joules. And we're doing, I don't tend to go at 10 hertz, I tend to run at about 7 hertz. And obviously there's no cooling because we're not in contact with the skin. And we're trying to heat up these little micro vessels that are sitting in the tissue. And this is typically the kind of result you will see after 1 or maybe 2 sessions. So a vast improvement in that redness. And I think the other big advantage of doing this is in many cases, a lot of diffuse redness can almost in some ways be hiding some of those little telangiectasia. And if we can treat the finer vessels that we've got here where you have this diffuse redness and remove all of that, then it's possible to see some of the other little telangiectasia, and then you can go ahead and treat those as well. Just sometimes they get masked a little bit by the amount. This isn't a very severe case, but when you see somebody with really severe diffuse redness, it's very difficult to differentiate the blood vessels. But if we take the little ones away, then the bigger vessels are more obvious, and then we can go ahead and treat those. And the last treatment option that we have on the system is onychomycosis. So we're using, once again, the ND-YAG to clear this fungal infection. One of the reasons why we like to use the YAG as opposed to the alexandrite is because it's a longer wavelength, it penetrates deeper into the tissue. So it means that we're getting lower and deeper into that nail plate. And by getting deeper into that structure, it means that we're getting better clearance. And importantly here, a couple of things. First of all, if you have a patient who's already taking topical or oral medication, they can carry on with whatever their treatment regime is. But secondly, because some of those topical and particularly oral medications can have some issues around liver function and renal functions, you can treat somebody who isn't able to take those kind of medications with the ND-YAG. So you have both sets of patients that you're able to treat. And very simple to do. We do multiple passes, as you can see from this diagram here, and we just move over the area, backwards and forwards, cross-hatching. So we go left to right, top to bottom, over and covering this area. And we go beyond the nail itself. So we're into the area around the nail, because very often you will get some of those little fungal spores that are sitting in that tissue as well. Hygiene following the treatment is critically important. We always say with every treatment we do that the post-care from the patient is really important. It's critically important when we're treating onychomycosis. So clean socks, clean shoes, clean towels, etc., etc. This is all vitally important in order to stop the reinfection or the spreading of the fungal spores. And here you can see this is 6 weeks after a single treatment. I think maybe you see better results in fingers, I'm not sure. Would you agree? Kind of quicker results rather than in toenails?
Yes, because of the growth rate of the nail, but generally this tends to be a toenail issue in most cases. Yeah. And this is not typical. It usually takes, it depends on the growth of the nail. So usually it takes 2 or 3 sessions to get this level of clearance because of the growth of the nail, but this happens to have grown quite well.
Yeah. And that, again, I think is an important thing to get across to your patients is each time we treat, we're destroying the fungal spores. But if the nail has been damaged, if it's delaminated, it's not going to improve the old nail. It's only the new growth of nail where they will see that improvement. And as you say, sometimes with toes, the nails are very, very slow to grow. So.
The other thing that's important, and I think you brought this up, is if this is ideal when we're combining it with additional treatments. And we have many patients who have failed a round of oral medication, but are on their second round and find that the combination of this treatment with the oral medication really makes a difference over the oral medication alone. So that's very helpful. It's also important to treat the entire set of nails, because it's very, very important, very, very easy to reinfect the nail. So I wouldn't treat just the affected nail, but rather you want to go ahead across all of the nails to make sure that you're applying the energy to the entire set of nails.
Yeah. Okay. Thank you. So that's the presentation. Do we have?
So we've got a couple of questions here. There's the question about how you choose the YAG laser when you have a lighter skin type. Are there cases where you should use YAG laser for hair removal when you have a lighter skin type?
I must admit, I tend to stick with the Alexandrite if I'm treating Fitzpatrick 1, 2, and 3s.
And
then I'll switch to Nd:YAG for the darker skin types.
Got it. In our practice, I totally agree with you. And sometimes even skin type 4, we start off with Alex, but depending on the time of year, and depending on, whether we've got a lot of sun, sometimes we'll switch over to the YAG in the summertime, even for our lighter skin types, just so that we can ensure safety, regardless of the time of year and sun exposure. That's one of the reasons that we'll switch. And sometimes we'll switch to YAG in the later treatments, particularly with the deeper follicles. So on the back, we'll often switch to YAG for men, just because the YAG penetrates much more deeply than the 755 does. The 1064 will go down to about 4 millimeters in depth. And that's another reason why these longer or these larger spot sizes are so important, especially with the higher total energy deliverable to the skin. But that helps really reach those deeper follicles. There's another question here about laser hair removal. And the question is, on the lighter skin types, on the scalp for men, do you prefer Nd:YAG or Alex?
That's a tricky one. And I think, again, it depends how much pigment there is in the tissue, whether you're going Nd:YAG or Alex. I mean, would you tend to go with an Nd:YAG rather than Alexandrite on a scalp?
Not in particular in the early treatments, but it depends, again, like you say, how much pigment, how much sun exposure. The Alex should do a very nice job, and then in subsequent sessions you can switch over to the YAG if you feel that some of the follicles are a bit deeper. But
deeper.
Yeah. Mm-hmm.
But I think the really critical thing here is that these patients need to understand that they need sun protection after they've had this treatment.
Absolutely.
They need to be using a very high factor.
Yes.
Constantly.
Yes. We say at least a 30.
And maybe wearing a hat when they're going through the series of treatments as well.
Absolutely. Because, there's a question here about using YAG over Alex in sun exposure. And I would say absolutely yes. But at the same time, it is important to say you're not to go sunbathe, or you're not to treat recently exposed sick skin. And of course, as you mentioned, the risk of hyperpigmentation post-treatment, post-inflammatory hyperpigmentation is there, regardless of whether you use the Nd:YAG, the Alex, radio frequency, something that has, ultrasound, whatever it is. Once you inflame the skin, that first week after that inflammation, it's really, really important to avoid the sun. So that's, I think, a great question. There is a question about whether the 755 could work for onychomycosis. Is it purely a heating effect in terms of mechanism? Is there a reason why we use the 1064 over the 755?
I think there's two reasons. One, the 1064 is going deeper in the tissue. And secondly, from a very practical point of view, we have to use a 5 millimeter spot size. And we can't use a 5 millimeter spot size on our system with an Alexandrite, because the 5 mil is on the vascular handpiece.
Yes.
And the vascular handpiece only works with the Nd:YAG.
Yes, and yes, and if you're using a smaller spot size, for sure, yes, the YAG is better. There is some literature on increased absorption too, as well, of fungal particles with YAG. Although there are other absorption spectrum, but yes, that's why we choose YAG over Alex. Some of our viewers are bringing up points such as the importance of trimming the nail and filing the nail down so that we can get that absorption. So I think that's a really great point as well. And one asks about nail polish. And I think that one thing that's important is and I've had patients come into the clinic with their nails polished or with their nail polish poorly removed. And it's so important to make sure that that nail polish is gone so that there's no absorption of laser heat into the polish. But and we generally don't encourage polish even after the treatment. There isn't a contraindication per se, but we don't encourage it only because it really does help when you're applying a topical medication as well as, in conjunction.
For the absorption.
Yeah. There's another question here. And one of our viewers is talking about how in the face, the axilla, the bikini for hair removal, they're noticing that the skin is becoming smoother and brighter. And how is that laser for hair removal making those improvements in the skin? What would you say, Hamish, there?
I think it's coming back down to the fact that we know, from various other treatments we do, that if you apply heat to the skin, we can reduce the pore size. So I think this is partly why. So they're getting an element of the facial treatment going on at the same time.
Exactly. You're improving that collagen. You're creating collagen with that heat application. And so you're getting a more uniform appearance, and so the skin is reflecting light much better. And of course, you're improving the texture as well. And our last question is about utilizing the 1064 painting technique for skin. And what would you say about using that technique if the patient has dermal fillers?
So if they're semi-permanent fillers, not permanent fillers, we say you probably want to wait a month before doing a treatment, and just remind your patient that the heat will probably start to break down those fillers more quickly than normally, so they will need to have them redone more quickly than they normally would. But if it's a permanent filler, we don't treat over it at all.
Exactly.
So any silicone we don't treat.
Definitely not permanent fillers. And I would further differentiate, I think, between hyaluronic acid fillers and biostimulators or non-hyaluronic acid fillers, like using calcium hydroxyapatite, which is safe at very, very high temperatures and doesn't break down. So I think that, using Radiesse, for example, if a patient has Radiesse, there's absolutely no contraindication to using this treatment. Similarly, polylactic acid, at the temperatures that we're going to reach with this particular treatment technique, you will not break down the polylactic acid either. And there's some interesting research that is underway to show that there may be some improvement, in fact, in moderately heating polylactic acid. But yes, I think that it is important, especially superficial hyaluronic acid fillers. I would say that the contraindication should be even 3 months, and the patient should be advised that there may be some earlier loss of filler. So if you can flip it around and do these treatments prior to augmentation, that's even better. But great questions to make sure that your patients understand what they're getting into. And that actually goes with any sort of heat delivery to the tissue, not just with gentle, but with across the board with devices. And I think that that is it for our questions. So I hope that this has been helpful. I thought it was really interesting, a great recap, and hopefully it jogged everybody's minds in terms of being able to utilize this incredible device in their practice and in all the different ways that you can to optimize what you're able to do to help your patients. And thank you so much, Hamish, for presenting.
Thank you.